Good afternoon and welcome to the daily update at the St. Clair County Emergency Management Office, where I'm joined with Chairman Mark Kern and Sam Behrman from the Health Department. And Sam, 208 I think is our countdown day.
We passed the 200 mark and we're still going.
We're still going, but we have some numbers today.
We do. While St. Clair County numbers are a little higher than we would like to see overall, we're still doing well. As of today, 94,230 St. Clair County residents have been tested, which is an increase of 587 from yesterday. We have 7,810 positive test results, which is an increase of 56 from yesterday. And that does include both males and females from under the age of 10 up to their 80s. And today our daily county positivity rate is 9.5%. We are at 86,420 negative test results. And unfortunately, we are announcing an additional death today, which does bring our total to 198 for St. Clair County. That was a male in his 50s who had unknown health conditions. And as always, our sympathies go out to his family. For those who have completed the IDPH required 10-day isolation period, we are at 7,160. For state totals, 6,033,289 have been tested, with 307,641 positive test results, which is an increase of 2,630 from yesterday. And for deaths, the state is reporting 8,878, which is an increase of 42 from yesterday. For hospitalization numbers for St. Clair County, currently we have 42 individuals that are admitted due to COVID-related reasons, and 3 of them are on ventilators. And for regional hospitalization numbers, we have 70 individuals that are admitted due to COVID-related reasons, and 6 of them are on ventilators. We have no changes to our congregate living facility and long-term care facility list today. We do still have some testing available this week if you are interested. Tomorrow, Thursday, October 8th, at the Moose Lodge, number 1221, we have testing from 10 a.m. to 12 p.m. and then again from 1 p.m. to 3 p.m. And then on Saturday, Sunday, Monday, and Tuesday, the 10th through the 13th, we have testing at St. Clair's Clair, which is in Fairview Heights at the mall, from 8 a.m. to 4 p.m. All 4 of those days. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we'll move into the zip code report. At this time, these are the changes in St. Clair County zip codes. In 62201, we go up 1 COVID positive today to 250. 62203 goes up 3 to 226. 62204 goes up 1 to 155. 62205 goes up 1 to 220. 62206 goes up 2 to 479. 62208 goes up 2 to 468. 62220 goes up 4 today to 601. 62221 goes up 5 to 723. 62223 goes up 2 to 471. 62226 goes up 4 to 813. 62232 goes up 1 to 202. 62255 goes up 1 to 18. 62257 goes up 1 to 38. 62258 goes down 1 today to 199. 62260 goes up 3 to 155. And 62269 goes up 4 to 611. As Sam said, we had 56 positives today with 587 tests. So that takes our daily county positivity higher than what we'd like at 9.5%. But our 7-day rolling average continues to look good with 5.4% being that 7-day rolling average number. And we've been pretty well under the 6.5% level for a good time now. And we want to keep it that way. The state today, and I think it was a good thing we talked about earlier, the governor had a press conference, announced our regional positivity today was down to 6.3%. That's significant because once you get under 6.5% and maintain that for 3 days, then the mitigations will will be reversed, and we'll be able to, or at least the latest mitigations will be reversed, and we'll be able to go back to inside dining. So we're keeping our fingers crossed. We think the numbers look pretty good, that we'll be able to do that for the next 2 days, but we've all got to band together and continue to wear our masks, wash our hands, watch the social distance. Even if we are allowed to reopen, which we think might happen, we've got to stay under an 8% level then. We don't want to get back above 8 and have additional mitigations put on us. And that's not just a message for Team St. Clair, because I know you hear it every day, but it's for the whole region. And I bring case in point, so we get the county positivity today at 6.3%, but the other counties, Bond County was at 12.5%, Clinton at 8.2%, Madison once again helping out at 7%, Monroe County comes in at 31.7% today, Randolph at 12.2%, St. Clair, 4.8%, according to the state numbers, and Washington County at 2.9%. So we got to make sure the rest of the region starts to pull for this. It's important if we're going to maintain these levels to be able to, for St. Clair County to stay where we are. We encourage everybody to kind of band together and help police this situation. I mean, I think that really. Making sure that you go to the small businesses that are the ones that are complying, the ones that are requiring not just for your safety, but for the safety of the people that you're with and the people you're going to be with. Carrying this illness, the spread is what we have been able to reduce, and certainly if you're out doing all the right things, you're not going to be the one that brings that home. Herb?
Well, and, as you said, it was a good day when the governor came on and gave the press conference with IDPH. That's something we've all been working hard for, all of Team St. Clair. And we immediately, earlier today, posted it up on the page. And I think the last I checked, there was like 12,000 views on that. And, of course, just what we figured, the naysayers on there saying, well, people's been opened up. And so we posted on there, so yeah, there may have been people that was open, but for most of the people in St. Clair County, they were being responsible. We've talked about our business owners, the restaurants that came to the county board meeting. They have been full of support for this, all of the mayors, for those businesses that were opened up. We said this last week. It would not surprise me if their insurance was not in force. That's a chance they take because they went against the executive order and against IDPH's guidelines. But we are at 6.3. If the numbers continue to look they do over the next couple of days, we can get that behind us. But doesn't mean we let the foot up off the gas.
You can't. And those who are enjoying the lessening of the restrictions need to thank those who have been complying. So the businesses and the mayors and all of the officials that have been out there and the businesses that you've been going to that have been enforcing these compliances, these recommendations from Illinois Department of Public Health, they're the reason that the number has gone down.
Yeah, exactly.
And so make sure you go back and the places that have been complying, they're the ones that you should spend your dollar with, because they're the ones that cause the number to go down, that allow us to be able to have those freedoms that we really want and we really need.
Well, and as we said last day a couple times, the other counties surrounding us, it's nothing personal. It's just that we got thrown into the region, and they should be looking at that also. The capital facts reports that come out says that even St. Clair County's model that we've been using ought to be a statewide model because it's been successful. Back in August, we were at 10.8 at one time. And to come down to 6.3 is just a pat on the back to all of Team St. Clair, all of you who follow these briefings daily and spread the word, post it and tell your families and friends the importance of wearing a mask, washing your hands, washing a social distancing has paid off. And the business owners who have had to conform, had to restructure their business, they did that because they wanted to be a part of the solution.
And you can see by the numbers who's complying and who isn't. It's not an accident that our numbers are where they are. It's because of work. It's because of dedication, and it's because of doing the things that have been recommended by the medical community. Washing your hands, watching your social distance, and wearing the mask.
And one other thing, Sam, well, we've got you here with us because you do it so eloquently. There's questions that come up. Well, why do I need to get tested if I feel okay? Can you explain that again to our
Absolutely.
viewers?
So what we've seen to be proven now is that you can be completely asymptomatic, have zero symptoms, and feel completely fine. But you can be tested and come back positive. So the purpose of testing everyone, even if you aren't symptomatic, is that we want to identify those people that don't have any symptoms but that are positive, so we can have them quarantined so we can slow the spread. Obviously, you know, if you're out there, you're feeling fine, you could potentially be spreading that to someone that's around you, those at work, or any loved ones. So that's why we have people get tested. Even if you're feeling okay, we want to identify those people that are positive so we can quarantine and have them isolate so we can slow that spread.
And think about what's happening right now in the White House. I'm sure that no one knew that they had COVID when they went in there, but obviously someone did, and the spread affected everyone, even to the point where the President of the United States has COVID, and that's as a result of someone who was asymptomatic, I'm sure, didn't know they had it, being there and shedding that virus to a lot of people. I mean, that's a large amount of spread that occurred there.
Well, and the one last thing I want to mention is, and it's always the most terrible thing that we have to do is, you heard Sam mention we had another death in St. Clair County, brings our total up to 198, and any death is terrible. This was a 50-year-old person. So all of the baloney about, we heard for months that, oh, it just affects the elderly that are in the long-term healthcare facilities. We've had family members come on here and talk about the loss of their loved ones, and they weren't the elderly. And now we just lost another individual in his 50s. Terrible. So, you know, there's more tests out there showing it's in the younger population. So for those of you who take it serious, thank you for being a part of the solution, for spreading the word, wearing your mask, washing your hands, watching your social distancing. As I say all the time, for those of you who still haven't been convinced yet, and if you aren't, then I don't know where you're living at. It's time to take it serious, because even though our numbers here in St. Clair County are at 6.3 today, we hope to keep them down for the next couple of days so our businesses can get open back up, we can have indoor dining, and we can start getting back to some normal. That doesn't mean that the light switch has been turned off. It means we still have to stay focused. We still have to do, this virus is going to be there until at which time there becomes a vaccine available, and nobody knows for sure. You know, if we could tell you, then we'd win the contest probably. But right now, we're going to continue to move forward. The next 2 days, we're going to be working on these numbers. We want our businesses open back up. We want them more than you know. So let's have a good evening. We'll be back momentarily with Cindy to translate this into our Spanish communities. And then tomorrow we'll be back with more numbers for you. Have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the